we will go ahead and get started and welcome. This is our next webinar in the Thought Leadership Series, and also discover how to grow your care management service company. I'm Justin Barnes, advisor to ChronicCareIQ, and then also co-founder of the Health Innovation Think Tank, as well as host of This Just In radio show that broadcasts on Healthcare Radio, Business Radio X, Health, Vive, and HIMSS Radio. I've had the privilege to work on Capitol Hill for 20 years now, testifying on more than 23 occasions regarding value-based care, chronic care management, virtual care, precision medicine, many more key topics for our industry. In that capacity, I've also worked each year to educate Congress as well as the administration on the importance of increasing the physician fee schedule and also creating bonuses as well as incentive payments for care providers that engage value-based care. This certainly includes all chronic care management programs and services. I'm going to give a brief update on what I'm seeing on Capitol Hill today and also what I'm seeing across the industry, and specifically CCM and RPM success. And very excited to dive in for the content today. But specifically, what I'm seeing out there is more care providers than ever before are deploying chronic care management programs. And importantly, it's to augment the current as well as future FFS, or physician fee schedule reimbursement cuts. Specifically, we had a 3.4% cut that went into effect this year, but also every year for the at least next 5 years, we have cuts coming. They're much smaller than the 3%. They're less than 1% in most cases, but we have physician fee schedule cuts coming every single year to the physician fee service. So it's important that we look at these types of programs in chronic care in general. That could be CCM, RPM, TCM, PCM, all the different management programs, and we'll talk about many of them today. But it's really important to begin reviewing them, researching them. How can they be integrated into your care strategy, into your care planning? I know many of you, are joining us today for that exact reason. So congratulations for that. And I think you probably know this, but deploying these chronic care management programs are foundational first steps for engaging value-based care in general. So I want to congratulate you on that. Value-based care is a very big topic. It means a lot of things to lots of people. It sounds complicated, but chronic care management, CCM, RPM, and all the management programs are perfect. They're a foundational step, and they're instrumental to value-based care in general. So you're in a really good direction already if you're here today. So in healthcare with CMS and many of the private payers, we've hit a tipping point for these programs where the funding and investment is only increasing year to year. They'll always tweak the programs, try to make them better, make them more applicable to more patients, more providers, more organizations, but there's only more funding being allocated for these programs every single year, and I do not see a change in that. And specifically, success by the numbers, 94% of respondents to one of the recent surveys that I was able to participate in talked about improvement for the patient outcomes. So that's significant for RPM. I mean, we've all seen a lot of this, certainly when you engage in these programs on your own, but 94% say that we improve patient outcomes. Also, 73% have yielded a positive return on investment. So again, a lot of us get into this industry because we want to care for patients and care for our communities, but obviously at the end of the day, we have to be able to pay our bills and return, the investment there. So very important there. And 78% say that chronic care management ROI comes from additional revenue. So not just patient, advances, but also in certainly patient safety and patient healing, but also the revenue from the CMS and other payers. So very excited to see these numbers. And 100% of the organizations that I work with have experienced, unnecessary hospital visits and unnecessary readmissions, improved patient outcomes, a positive ROI, and then also a significant increase on Medicare reimbursement. So really across the board, positive increases and advancements with these different types of programs. So we're going to talk about this more today. We'll certainly leave plenty of time for questions. But at this point, I'm going to turn it over to my esteemed colleague, Blake Whitney with ChronicCareIQ.
Yeah, thanks, Justin. So my name is Blake Whitney, Vice President of Strategic Accounts here at ChronicCareIQ. I lead our sales team here internally, and I think you folks didn't come here to hear my story. So Justin, I think if you transition to the next slide, what I'll do is kick off with kind of the story behind ChronicCareIQ. Go one more back, sorry. The story behind ChronicCareIQ, and we were built and founded by a patient for patients. So our CEO and co-founder, Matt Ethington, was diagnosed with type 1 diabetes at the age of 30. And this is someone who was always active, very healthy, a competitive swimmer. And over the course of about 6, 7, 8, 9 months, started to lose some weight, walked into the emergency room, walked out with type 1 diabetes right in the middle of the healthcare system. And at that moment, he decided he never did not want to be around his doctor and care team got into healthcare technology, built and founded an electronic medical records company called Simplify MD, and started Chronic Care IQ in 2014, specifically tailored around monitoring heart failure patients post-discharge. And then Chronic Care IQ changed when Medicare came out with chronic care management in 2015. And the most important thing to highlight about Chronic Care IQ and chronic care management in general is it's just that, right? It's care management. It's not measurement. Many people get confused and believe that chronic care management is simply a 20-minute phone call, right? We're going to click a start button, click a stop button anytime we get off the phone with a patient. That's not it at all, right? It's helping people manage chronic disease. And the traditional model we have today, where patients come in and back to the office every 3, every 6, every 9 months, it's challenging for me and us to understand how patients can be expected to manage their chronic conditions that way. So the cost that America spends to manage these chronic diseases is equivalent to 18% of GDP. So out of everything that is made in America, 18% of that goes towards the management of chronic diseases. 7 out of 10 deaths that occur are a result of chronic diseases, and 99% of Medicare's payments are made on behalf of chronic patients. And that represents 86% of the US healthcare costs overall. So the model that we have today of someone getting sick and then getting sicker is not only expensive now, but we have 10,000 patients per day turning 65 over the next 8 years. And the problem is that doctors don't know what to do. That's not the issue. The problem is that oftentimes they might not know when. So if you go to the next slide, Justin, for me. The reason why is because traditionally they're invisible, right? When the patients are in the hospital, when they're at the practice, they're very visible, which also makes them actionable. When they leave, right, outside the hospital or the practice, they're invisible. So what Chronic Care IQ does is we illuminate the status of the patient wherever they are. And we do that in a couple of different ways. If you go to the next slide, please. We engage patients at their individual technology comfort level, and we send them a series of questions automatically. The questions that we ask, the frequency at which we ask them, and how we rate when patients are trending outside the lines, those are what we call clinical monitoring protocols. And these questions can be sent to the patients in a couple of different ways. Again, we were built and founded by a patient for patients. We let the patients choose how they want to engage. So they can respond via secure text, email, a mobile app that the patient themselves, their adult children or caregiver, can also download and respond to. We can send them a connected device, right? A blood pressure cuff, a weight scale that sends vitals back in automatically. Or we all understand, right? These are still elderly folks. Not all of them are tech savvy, and that's okay. In that case, what happens is we alert the care management service provider and say, here are the patients your care management team needs to call today. Here are the questions you need to ask, and here's when you need to call these patients. If you look at the 150,000+ patients we have in Chronic Care IQ today, we achieve regularly anywhere between an 85 and a 93% weekly engagement rate from our patients. And of the patients that start answering their questions, 87% of those are still answering, engaged, and responding 1 year later. And when they respond, their responses are scored now on a color-coded dashboard. So Justin, if you go to the next slide for me, the care management staff log in, and the very first thing they see, red, yellow, green, right? Super simple way for them to see what patients they need to get a hold of, gives them the situational awareness of those at risk. So they can quickly see who's trending in the wrong direction, who's trending in the right direction, who do we need to get a hold of now. So they go from having that situational awareness of their entire patient population to now where, if they click into a patient's chart, they have that actionable intelligence to see, why does the patient need me now? And we can make a decision to better treat the patient at that time. If you go to the next slide, Justin, for me, please. If you look at the way these codes work, and I alluded to it earlier, Medicare came out with CCM in 2015. At the time, it was one code, 99490, that reimbursed at $42. Fast forward all the way to today, there's over 25+ different reimbursements, 8 different categories, all of which we have in Chronic Care IQ. It's clear to see that Medicare is driving care in this direction. And a common theme with these codes is they are time-based codes. When you can establish that you have spent 20 minutes on non-face-to-face clinical activities caring for a patient that's consented to be managed in that way, you can earn roughly $61. That monetizes over $180 an hour. It's incredibly lucrative, especially when you take a step back and look at what's lumped into that time, because it's the work your care management service team is already doing, right? On the phone with patients, communicating with loved ones, maybe helping coordinate care with a specialist, medication refills inside the EMR. But the problem is if you don't have a system to help you track that time, it is death by 1,000 cuts. And that's where ChronicCareIQ can help. So we plug into the phone system, sweep up the inbound and the outbound phone calls, and can also plug in to the EMR to sweep up what we call clinical time. And once we do that, we generate an average of $103 per patient per month in reimbursement. And of the 150 plus thousand patients we have, on average, 73% of those patients generate at least one 20-minute code in that month. Next slide for me, please, Justin. Now, we empower care management service providers to really build and scale a care management service. And we do that in a couple of different ways. So the very first thing is you'll be able to handle patients from various different physician practices. And we do that through an enterprise-ready dashboard. And then it gives you access to see all of your sub accounts or your physician practices underneath with their unique patient buckets. And then high-level reporting. We automate the time tracking with our CallerIQ technology, integrating with the practice's EMR. And we give you a diversified range of solutions. So it's not just CCM, it's not just RPM, it's all the M's, like I like to call them here internally. So CCM, RPM, behavioral health, PCM, right on and on. So we give you the full suite of connected care codes to work from. And I guess with that, I'd like to introduce one of our preferred partners at MySEMA and Poonam Patel to highlight her story personally with MySEMA, and then what piqued her interest and how she's built her business with the help of ChronicCareIQ.
Sure. Thank you, Blake. Good afternoon, everyone. So yes, my name is Poonam Patel. I am a nurse practitioner with over about 20 years of experience in healthcare. I started off as a nurse, inpatient nurse. I was a provider in an outpatient clinic for endocrinology and childhood obesity. I also was working for a private insurance company for 3 years as a clinical consultant. So there was a lot of pieces that I was seeing in the healthcare industry as becoming overwhelming and daunting, and I wasn't able to help the patients as I had wished to or hoped to when I became a nurse way back when. And so you can move to the next slide. And I knew that there were ways or opportunities to do it a little bit better, which is when, fast forward about 4 years ago, I met Shazil, who is my co-founder and CEO of MySEMA. He, at the time, was dealing with a health scare with his mom and realized that coming from an e-commerce background and a business background, he had no idea how to navigate the system, how to advocate for his mom, and clinically manage her health issues. And so he knew and realized there were so many more people out there in the United States that probably need this same type of guidance. And so he wanted to create a service that would help families. And his goal is just to help people live longer, live happier with their loved ones, paired with me, who has seen all of the gaps in healthcare, who's seen the challenges our providers face and faced them myself in clinic, really empathizing how hard it is and how difficult it is for not just the patient, but for the provider too. And there were ways for us to get creative and innovative to build a service that could provide families this type of dedicated help. And so there was 3 buckets that we really focused on. It's health advocacy. So me as a nurse, I was really keen on health education, health promotion, proactive outreach, making sure they get to the doctors on time, navigating the healthcare system. We all know that's difficult. Most people who are not in the system don't know where to start. So our clinical kind of knowledge and experience helps families get things done faster in the right process and in the right order. And then the biggest one that all of us know about is care coordination. Gone are the days where you go into the office and like everything is figured out and then you go home and it's so fragmented and there's so many pieces that imagining a person who has chronic illness or just not doing well and trying to figure out all this stuff by themselves, for me, was the opportunity for us to lead with compassion, number one, and make sure that we're assisting families in the best way possible, coordinating the care in the fastest way possible, so we can avoid a lot of issues. Now, in that time, as we got it started, I started to learn about CCM. and the intention that CMS was having with these care management programs. And I realized, oh, hey, like we're doing this, but on steroids. So we need to go talk to some providers. We need to really offer them virtual support in between visits, to have a dependable partner to really help take care of their patients, but also the opportunity to boost revenue at the same time. But I needed something that would allow me to do this quickly, to scale it fast, and be intuitive enough as a clinical leader and operational leader to do what I needed to do fast. And so when I was looking for platforms, there were several requirements that I had, and I've highlighted a few. This is not all of them, but these were my biggest ones. It's really ease of use. Can the team navigate it quickly? Is it easy to see? Is it easy to act on? Is it easily accessible? Can I train quickly on it, and can I scale quickly with it? The second one, coming from my consultant background, data was very important to me. So being able to visually give data to my care navigators in a very succinct and organized fashion so they can act on it was super important, because that leaves off a lot of manual effort that they can then focus on the patient to take care of them. Staff productivity, obviously, as an operational leader, I have to make sure the team is doing what they're supposed to, but also meeting their metrics, meeting their goals, and doing the care in the way that they're supposed to do it, with, again, not a lot of manual effort. As a clinician, documentation is a big deal for me. So being able to create templates and having protocols or questions that I can, consistently make sure the team is asking, so we're aligned on how we provide our care, was a key element for me in looking at a platform. And then at MySEMA, one of our core values is integrity, right? Like building trust with our patients, building trust with our providers. But one of the biggest things for me is making sure we stay in alignment with CMS and making sure we're keeping the requirements at the forefront of everything that we're doing. So that way for an audit, we're ready, we're prepared. I don't have to worry. I don't lose any sleep over it. And then having a platform that was agile enough for me, because again, I think outside the box. There's a lot of ideas that I have for CCM. There's things that I experiment with our provider partners that if they are open to doing. And so I needed a platform that would allow me to get creative and not hit a lot of roadblocks doing it. Next slide. So in my research, which was a very long process, I went through a lot of platforms. I played around with a lot of things. CCIQ caught my attention for a multiple kind of array of reasons, but I've picked my top ones, and I'll kind of talk through those. So one of the biggest things that I loved was the fact that they were visual tools. There were graphs, there were trends that a care navigator could easily see and focus not just on the what. A lot of times in clinic, I was focusing more on the what because we didn't have the time to focus on the why. And so then what happens is my team is confident with the data they're presented, and they can act on the why and really help with behavior change or adherence, or, hey, why aren't you taking your medications? Oh, it costs too much, or logistically, they didn't have a ride to the pharmacy. I think where healthcare needs to have a little bit of a shift is, yes, we have the what, but we really need to focus on the why and help with solutioning the why. And that's kind of a goal of how we do CCM, is get to that point of helping a patient at the extent of the why. The easy patient uploads and bulk editing is my best friend. So, a provider says, hey, Poonam, we have 500 patients. I'm like, great, give me a file. I can upload it. They can activate them pretty quickly. We can start CCM really quickly. It's pretty hassle-free, not a lot of work. That was my best friend right now. For operational efficiencies, there's a lot of tools. There's messaging, there's reminders, there's tasking, there's dashboards that will help me see patient kind of progress throughout the month, which is very helpful in a visual fashion. Being a stickler and type quadruple A person, the auditing tools and reports that I can get into, I think I got into every single report with CCIQ, and I have studied them backwards and forwards. They help me a lot. I am very confident what my team is doing every single day, every single week, and every single month. I can see everything. I can see sign-ons, I can see time, I can see everything. And that gives me a lot of peace knowing that I have access to that type of information. Billing reports, super easy. Like, they basically are all encompassing. They give me everything I need to know. The fact that you can bill from the system itself is very good for a provider's practice, to not have a lot of other platforms. You can do it all through one place. Our provider partner is so impressed by the fact that I can quickly resolve their billing team's questions about patients and, hey, what did this patient bill in December and January and February? Can you help us? I can get them the answer in a matter of a few minutes, which is not something that I saw across the board. So this was actually a very big win, in my opinion. And then the last one is really kind of alluding back to what Blake talked about of the why of CCIQ. When you work with CCIQ, they really want to help you succeed, and they want you to do CCM at the intent of why it was created, is to really help the patient. And you can tell when using the platform that the patient is first. They're looking at the patient and the status and giving you scores and really being able to identify patients that need help quickly and communicating to a provider. And just their story about how they came about, and the fact that Matt himself was a patient was dear to my heart, coming as a provider doing this type of work. And so it was very nice to see that they also have webinars and educational seminars for CMS requirements. Like all of that is very, very helpful as you evolve a CCM practice. Next slide. So my CMA's approach was kind of tweaked and kind of stood up really quickly because of what we were doing already. And one of the things that I found is being a clinician and being able to build a whole protocol so easily, because we kind of knew where all the gaps were, was so helpful. But one of the biggest things for me is hiring and training a very clinically experienced staff. So, you know, my requirement for the staff here is you have to have worked in a clinic, you have to have either done CCM or you understand the intent of CCM. And we're really here for the right reason, which is to take care of the patients holistically. A lot of times what I found when I was going to these RPM sessions and CCM sessions, people were so focused on the disease that qualified them for that program that they weren't looking at the patient as a whole. And for me, I need to look at the patient as a whole. So my protocols are built to where we see the whole patient, help and assist in any possible way we can, and partner with the provider to make sure they're getting the best care. And I've kind of said this over and over, but something that I do regularly is always study CMS guidelines, see when the updates have come up, and then update our processes and protocols to make sure they're in alignment with them, so we're never kind of out of line with our approaches. So our initiation and implementation is actually very seamless. There is a whole implementation checklist that I have created after doing this and studying how to get it done. My CCM care navigators are well kind of proficient in CCIQ. They also are very proficient in navigating EMRs, and then being able to follow our protocol to get CCM up and running, pretty hassle-free for the provider. But one of the things that I really kind of focus on is building a bi-communication channel between us and our provider partner, either with a liaison there or a nurse there or somebody there, for us to kind of promptly communicate about patients with concerns or questions that we may not be able to alleviate at that given moment. As a provider, for the provider, I value all the providers that I partner with and all the providers who are here giving care to patients. It is not an easy job. I try to make it as easy as possible in aligning with the clinic's way of doing things. And so every clinic has their triage parameters and their sick protocols, refill request protocols. So one of the things that I like to focus on is really learning those things with a provider partner and making sure we are in alignment on how we do CCM with you or with our partners. So it's all very consistent, and it's very seamless for the patient as well, that they see us as a partner of their provider. Everyone can trust and depend that the team is documenting. We can make sure that you can find the information that you're needing at any given moment. And then having regular touch points with the provider group is very important to me, where we review data, quality outcomes. Is there any feedback? Is there any enhancements that we can make? And being fluid with growth and evolving to create a really cool, robust CCM, RPM care management program for that provider group. So we do it in two different ways, and CCIQ has helped us kind of decipher how we do this. The hybrid model is one that we do. I really like this model for providers, because what it does is gives me and my team the accountability and responsibility of initiating our protocol to the patients, providing virtual support between visits for a provider, and getting everybody to that first 20-minute billing code. Why? Because then what you guys can do, or providers can do, is have the care that you're already giving, start documenting the time, and you can start unlocking higher billing codes, higher revenue. So you could actually bill the 99491 code, which is a higher reimbursing code, and that can unlock just a lot of potential in the program as well as with your revenue. And then the full service model is where MyCMS implements the full suite of services. There is no kind of boundary in which we will and will not help. And what this helps do is give us the responsibility of the whole program, partnering with the provider, but it helps us achieve, the 40-minute code, 60-minute code, even complex care codes every single month, which then gives a full quality service to your patients, but then unlocks this like higher revenue opportunity as well. Next slide. So I would like to kind of just depict an example of a provider group that MyCMA worked with last year, and just kind of depicting how quick it was, how fast we were able to stand it up, and like how fast we were able to add the patients in. And so CCIQ really helped us because we were able to stand up our protocols pretty quickly, but then the question was, how do we create, profiles in CCIQ, and how can we get them started in CCM? Well, we were able to easily upload patient volume incrementally. You can see on the graph to the left where incrementally every few months we were able to kind of just load more. The care navigators, became super confident in navigating this patient volume and their patient loads because of the help that CCIQ provides with the alerts and the messages and reminders. And then the provider partner started noticing some really great things that, we were helping use or utilize sick visits more on their calendars, their appointment scheduling. We were able to avoid unnecessary ER visits that most historical patients were doing notoriously. We were able to push the right patients to the ER because of proactive outreach, and really help in many different ways, like refill requesting and referral management. And they saw all these like little cogs in kind of working together, which has been really great. I think one of my most favorite and fulfilling parts of why I do CCM and why I became a provider is hearing the relief in the patients' voices, that there is a dedicated team working with their provider in between visits, making sure that they are, number one, taken care of, they are okay, and they have a dependable partner to close any kind of open gaps and help guide them go get the right care. I think that is one of the biggest intentions of CCM in these care management programs. And if we can do it right, everybody wins. The provider wins, the patient wins, the CCM team gets rewarded for all of the care and appreciation they get. And then down to the bottom on the right-hand side, you can see that because the intent is there, and if we do it right, you can see that the revenue also is in alignment with what you are doing in the system of CCIQ. It kind of just helps you kind of incrementally increase your revenue. And so these two graphs will show you the increase in patient volume and then the potential trajectory of your revenue. And this is real revenue. This is not made up. This is what we're doing today. My hope for this provider group is we continuously increase that and kind of see this change happen over time as we evolve with these care management programs. So lastly, I'd really just like to appreciate, everyone taking the time to come and join the session. It is an honor to partner with providers out in the, in the industry, kind of helping patients. It's also very honorable and partnering with CCIQ to help fulfill MyCMA's mission, which is to transform lives in a very impactful way. So our hope is we can continuously positively impact patients' lives, and we hope we can continue to grow together.
Thank you very much, Poonam, and thank you very much, Blake. So I'm going to turn it over now to some questions that we received. So if you have any questions for any of us, please feel free to post it in the Q&A chat section, Q&A question section, and we will certainly address the ones that we can. So first question that came in, what is the next step for CMS for CCM and RPM? So I'll take that one. Specifically, well, CMS in the whole CMS team, they really look at, and CMMI, the innovation sector of CMS in general, looks at these programs, really continuously on a quarterly basis. They look into different results. What are we achieving as a country? What are we achieving as providers? What are we achieving as patients? They also have numerous open comment sections in sessions as well. So you can actually provide your open comments and suggestions to CMS. Over the last 20 years, I'm very impressed in how transparent they are for a government agency, but also just how they look for our comments and they take our feedback. So I do highly encourage everybody to engage CMS, but specifically with CCM and RPM and all the other management programs. they're just looking to expand these programs. They're looking to make sure that we are achieving our goals. They're looking to see what new codes can be developed. How can these codes be optimized? So, again, like I said in the opener, I don't see anything changes. You may just see things evolve. You won't see things being canceled unless that service is not working for some reason, but then they'll evolve it into something else. So these are just not going to just go away overnight. These are, set in stone in a lot of ways, or at least as much as they can be in government regulation. But these programs are all moving forward very well, adopted by CMS, and a lot of support internally, a lot of support obviously in Congress. The average, the patient that presents themselves to an ER can cost you between $10,000 and $20,000 for every ER visit. So if we can, stave off 2, 3, 4 of those a year per patient, because when you look at these chronically ill cohorts and patients, they present themselves in the ER, and that's extremely costly. So it's, much less expensive to pay for care management services and for the chronically ill consumer. The ROI is significantly there for the government and also the private payer, and certainly us as a country that pays all those bills. So, only more support coming by the way of CMS for these programs. And I'll be honest with you, even the AMA. So it is actually I just wrote a comment paper that I'll be presenting to the AMA tomorrow, trying to even look at the 60 minutes that's needed for the RPM service. So maybe even break that up a little bit, so you don't need the full, 16 days. You need the full 16 days. Maybe they'll break it up, or maybe you only need 2 days to start off with, and maybe 5 days, or some type of increment between. You get the 16 days to get the reimbursement for RPM. So we're looking at different variations there as well. And AMA is about to have a comment period on that that will close April 25th, I believe. So I want to get my comments in for that. Next question here. Does ChronicCareIQ focus just on CCM and RPM? Blake, I'll give that one to you.
Yeah, the short answer is no, we don't. Obviously, those are the main ones that everyone hears about, but we have the full suite of connected care codes. So chronic care management, remote physiologic monitoring, transitional care management, principal care management, which is just CCM for specialists, behavioral health integration, collaborative care management, oh goodness, Justin, chronic pain management, and then soon RTM, which is remote therapeutic monitoring. If you want to learn more about those codes, go to ChronicCareIQ.com, and under the resources tab, you can download our 2024 connected care code summary that outlines the national average reimbursement, a description of the code. That'll be a good resource for you guys to check out as well.
It's excellent. Excellent. Next question here. What was your onboarding experience like after signing up with ChronicCareIQ? So Poonam, what was your experience like?
Yeah, I mean, it was pretty quick. I'm a pretty fast-paced person, so I was kind of concerned with all the questions I had and, everything that I needed to know about the platform. It was a very quick stand-up process. Again, the platform itself is not hard to use. It's how do I implement my protocol within that platform. So CCIQ is very quick to train. They have great resources, recordings. They have handouts. There's just everything is already set up. They provide us with a one designated person to help us in implementation. So there's multiple sessions that we have. They're accessible via email or phone. So always very quick to help. And I was able to stand up, the CCM program. I think, Blake, what was it? 4 or 5 weeks. It wasn't very long at all.
It was not long.
It's excellent. All right, next question here. What is your strategy when approaching physician groups to get them to sign on with MyCEMA for CCM services? So Poonam, back to you.
It's funny because people ask me this question. I just go in with my authentic self. The point is, let's take care of patients together, right? Let's see how we can do that. I want to make your life easier, and I would like to make our lives easier by implementing a checklist, implementing CCM properly or RPM properly, and really focus on the patients. But, the funny thing is, people don't also realize that I want to help providers too. I was in the clinic before. I know what it's like, and not having that virtual kind of awareness of what's happening to my patients between visits. It is kind of daunting. I used to lose sleep over it. And so I really kind of highlight how I like to take care of patients and what my wish was when I was in clinic. And filling those gaps for a provider, partnering with a provider. I really like to highlight those things because that's truly what I'm doing it for. It's a very non-business answer, but what I believe is if we do it the right way and we're taking care of patients the right way, you will build the codes the right way and everyone will win. That's just my belief in how I approach with providers.
It's excellent. It kind of goes back to, I mean, we do focus on the financial components because we all want to pay our bills, but the increase in quality of care and quality of life for these patients is significant. And so that's a big byproduct. And we try to pull that out. I know, Blake, you and your team have built some great case studies there at ChronicCareIQ that highlight some of that. But that patient story is really, really important. So we focus heavily on the care providers and the care management service, but also when you really get into these patient stories that, these life-saving stories that we're able to publish and that are out there, that these, care management services and these care management strategies are bringing to our community. So it's exciting to see. And again, these are all foundational to where value-based care is going. So it's really important that you do, continue to learn, participate in these types of programs and see how can chronic care management be integrated into my care strategy? What can I do as an organization or as a practice or as a service to be able to enable these types of opportunities? Because again, it's a great way to stave off these cuts. I mean, the average provider, I want to say, that uses CCIQ, even from the research that I've done and been able to participate in, they bring an additional $12,000 to $20,000 a month additional revenue to the bottom line. That's per provider. That's pretty significant. Certainly when we say that 3.4% cut, we need to find new ways and new revenue sources to bring into the practice and the organization. So again, chronic care management, it's great for the money, it's phenomenal for the patient, but also it's a natural glide path to where healthcare is going in the country, where value-based care is going in America. So it perfectly sets you up. If anybody has any questions, please feel free to post them in the Q&A and we will absolutely get to them. Next question just came in. How many patients can one of your care managers manage? So actually, Poonam, I'll pass it over to you. And then Blake, also, you work with a lot of, providers. So I'll pass it out to you after Poonam.
Yeah, so again, my outreach process is a little bit different than most. So because we do a lot of phone calling, my ratio is usually around 1 to 300 a month. Again, it depends on which model the provider chooses. If one is a full service model, that ratio drops a bit. If one is just a hybrid model, that ratio can go up. My emphasis is on phone calling. I think that makes a huge difference. I understand why technology can supplement some of what we do, but having that touch point with the patient is important to me. And so I make the ratios where realistically my care navigators, my case managers can call patients and really kind of form that rapport and trust with them. So my ratios are a little bit different than probably the standard. I think the standard is 1 to 500. Again, just depends on your process and protocol, but that's kind of where I sit.
Excellent.
Yeah, and that's not too far off from our national average. I think the average care manager in ChronicCareIQ manages about 325, 350 patients, somewhere between there. And the key there is how are we managing those patients? It's a whole heck of a lot easier for the care management team to triage a red, yellow, green dashboard when patients are submitting responses to questions, have you had more good days or bad days? Experience any new swelling in your ankles? Based on how those patients respond, they're scored red, yellow, green. That's a whole lot easier than traditionally, let's make 300, 400, 500, 1,500 phone calls every single month. So it just depends on the individual group where the patients are located and their technology comfort level. If you look, again, at the 150,000 patients we have in ChronicCareIQ today, roughly 60% of those patients are technology-based patients where they're downloading the app, they're responding via secure text or logging into the computers they have in their home. The other 40% are what we call phone patients, and that's what Poonam mentioned earlier, where their team is calling them, taking them through a series of questions or protocols to receive that information.
That's excellent. Thank you, Blake. Thank you, Poonam. Any of the questions that we can answer for you? Obviously, we truly appreciate everybody's time you took out with us today here, and we'll certainly be sharing these slides out. But got a couple extra minutes here. If anybody have any additional questions or comments or thoughts, please post them into the Q&A section. We'll absolutely address them. No, again, if you don't have anything else, we'll let everybody else have a great rest of your day. Thank you very much. Again, we'll be doing these webinars every single month. It's part of our thought leadership series. So feel free to join us on any one of these, and we look forward to seeing you again soon. Thanks again. Thanks, Poonam. Thanks, Blake.
Thanks.
Thank you.
Bye.